Hey everyone, it's Dr. Dan Lieberman, neurosurgeon, and I'm here to go over the 5 things you need to do if you have non-specific low back pain to take care of yourself. This was a question which came to us from the YouTube channel, and I was really excited to get it because in my clinical practice, I've been out of practice for a few years now, but for 20 years, this is one of the most common situations that I faced, and there's a lot to it. And before we kind of unpack it all, I think the best thing to do is kind of just start at the beginning, and that is start with the question that somebody actually asked. So let's look at that and kind of go from there. This was the question we received on the YouTube channel. I'm not sure if I have a herniated disc, but that is what I have recently been told from chiropractors and a sports doctor. Sports doctor, probably an orthopedic surgeon, right? I did get a one-time tramadol shot and the pain went away for that day. Tramadol is listed as an anti-inflammatory drug, but it's actually a narcotic. So the fact that the pain went away and then came right back tells me there's an ongoing pain generator and they're definitely suffering with organic pathology. I can't touch my toes or even bend over slightly. Ah, such a bummer. The sciatica pain hurts a lot in my glute hamstring area. Sciatica refers to pain, that electrical type pain that shoots down from the back, down the leg. Now, important that they don't associate it here with any numbness or weakness. And I certainly don't see any mention of bowel or bladder lack of control or inability to walk or anything of that type. But still quite severe. Hurts, can't even bend over. The pain has been changing. It's not terrible now. Oh, well, that's a relief. I mean, this kind of pain can be just earth-shattering. I got through the worst part of my journey, which required me to get an oral steroid because the pain was so bad. IDK, what to do? Please help. I'll tell you, these kinds of situations just really tear at my heartstrings because I've seen so many people who really have suffered so much with problems of this type. It's some of the worst pain out there, and that pain leads you to panic. One of the first things that happens is you're like, oh my God, I can't live like this. What am I going to do? Well, hang there to the end of this video, and I'm going to walk you through exactly what you need to do. I'm going to tell you everything that you need to do. And I mean, I don't want to intimidate you, but it's a lot, right? It's not a couple seconds worth of stuff. It's a fair amount of content. In order to kind of organize it in some way, we're going to organize it according to a timeline. I realize that you're watching this because you already have the problem, right? So I don't know where you are on this timeline. And one of the first questions I often get is, well, you said to do this from 3 to 6 weeks, but I'm 8 weeks out. What do I do? You catch up. You start at the beginning of the timeline and you do everything on it right up until today. You don't wait 3 to 6 weeks to get started. You do everything you need to do to catch up to where you are on the timeline. And then you let the timeline be your sort of guide to get you through the rest of it. All right, here's the timeline that we're going to go over. Timeline for the treatment of nonspecific low back pain. First, once again, don't panic. We got you. That's what we're here for. I've seen thousands and thousands of people in this situation. I'm here to help, and let's walk through it. In the first 3 weeks, so from the time the pain started for a period of 3 weeks, the first thing that you have to do is decide if you need to act. Do you have any red flags? Because if you have a red flag, that's an emergency. That's not watch the rest of this video. That's turn it off and go to a hospital and get this thing taken care of. What are those red flags? We're going to go through a checklist to give you a good sense. The next thing you need to ask yourself in the first 3 weeks is, do I have numbness or weakness? And is it functionally limiting? Numbness is, you can't feel the light touch, and the best way to test it is to test yourself on both sides. Just light touch, big toe outside of the foot, along the shin, and on the inside of the knee. The best way to test your strength is to see if you can walk up on your tippy toes, walk on your heels, then stand on one leg and squat down, stand on the other leg and squat down. If you can do all of those things equally on both sides, then you do not really have significant and certainly not functional weakness. Because if you got numbness and weakness that's of functionally limiting nature, you don't need to act emergently, but you do need to act urgently. You need to go see a doctor and get it taken care of, get evaluated within the next couple few days. But assuming that's the case, there's no red flags and there's no functionally limiting numbness or weakness, then we'll go over the big three. There's literally thousands of things that people have tried for back pain, but only 3 of them have consistently been shown to work. And we're going to go over those 3. Once we finish with these first 3 weeks, we'll go to the 3 to 6 week period. This is where I need you to watch one of our videos. I need you to start thinking about, well, here's what it feels like. What could it be? Because that's going to make a difference as to what we do next. Some people in that 3 to 6 week period actually need an MRI, and those people might be going on to epidural. So that's something that we'll explore. Then I need you from 6 to 12 weeks to, it's time, 6 to 12 weeks into this, it really hurts. It's time to see a doctor. That could be a chiropractor, primary care of the musculoskeletal system, good chiropractor, or your primary medical doctor, one of those two. We need an x-ray to make sure this isn't a compression fracture, some kind of infection, or even cancer. I don't mean to scare you. It's very, very, very unlikely, but we need to be safety first, and go ahead and check. This is also a good time to think about physical therapy. If you want, all of us deserve someone to help care for us when we're in pain. If you need someone standing right by you during this time, then this is the right time for that. Then we get into the, this greater than 12-week period, and at that time, it's time to get an MRI and an x-ray for everyone. We'll talk about what could be wrong, what video you need to watch to get prepared to know how to act, and then we'll take it from there. All right, let's get into it and talk specifically about that first few weeks. The minute you feel back pain, and again, this is not going to be the case for 99% of the people, but in case it is, red flag survey. I need you to do this checklist. The spine, in your lifetime, this is very unlikely, 1 in 10,000 that it's going to happen. But if it's you, we need to act immediately. You need to act immediately if you can't pee. The nerves that go into the legs that go through the spine also go to the bladder. And if something catastrophic is going on, and this is usually also can't walk, by the way, but if you can't pee, if your urine is accumulating and you just can't empty, that's an emergency, and we need to, people don't often associate that with their back, but it certainly can be. If you can't empty your bladder, we need you in a hospital. If you get functionally limiting numbness or weakness in both legs, game over, you need to go to the hospital. A lot of conditions can affect one side or the other, but if it's affecting both, that's a red flag and needs to be dealt with right away. And I think the way to think of that is if you can't walk is another way to think about it. The third one is trauma. If you've been in an accident and you're having numbness or weakness or uncontrollable pain associated with your back, that's a real sign you could have instability. You may need to act sooner rather than later. And so that's time to get evaluated. By the way, if you live in a town where there's multiple hospitals and you do have one of these red flags, go to the hospital that's the trauma center. They're going to have a neurosurgeon and an orthopedic surgeon on call. They're also likely to have the imaging that you need on an urgent basis, so that would be the place to go. History of cancer, prostate cancer, colon cancer, notorious for going to bones, including the bones of the spine. You can get metastases to the epidural space. This is very rare. If you've had cancer, though, you're obviously in a different category, and this is something that needs to be checked out sooner rather than later. And then the other real baddie is infection. If you get fevers, shakes, or chills associated with back pain, that's an emergency. That's not something you can sit on. That's something that you need to get evaluated right away. Whew, that was a mouthful, right? Look, I realize that 99.9% of you are not going to have any of those red flags, and that's a really good thing, obviously. But I just want to get it out there because, well, better safe than sorry, right? And we want to make sure. So No red flags, you're cleared to go along with this. Um, you know, so you're in that first 3 weeks and you want to know what to do. And I want to tell you, there's literally hundreds of things that people have tried, and there's so much fake crock of stuff in this area. There's really three things that have been shown to work, and only three things. And those three things are rest, nonsteroidal anti-inflammatory drugs, as well as moist heat. Now, I mean, everyone who goes through this says, you've got to be kidding me. I feel like I want to cut off both my legs. My back hurts so bad. There's got to be something else. There isn't. Those are the three things. The narcotics, Percocet, Vicodin, fentanyl, no, no. Proven not to be helpful for this kind of non-chronic, non-perioperative, non-cancer pain. So you do not want to go into any of that stuff. In the question I'm answering, the tramadol shot, questionable. You know, tramadol is listed as an anti-inflammatory. It's actually a narcotic in the way that it acts. If you need a shot of anything, I would have preferred Toradol. That's a non-steroidal anti-inflammatory drug. Now, it's not for those of us with ulcers, a history of ulcer disease, or GI bleeding, heart problems. A lot of cardiologists restrict NSAIDs, kidney failure, or anyone who's not healthy enough to take NSAIDs. But if you need a shot, it's a shot of Toradol. Better yet, just take Aleve or ibuprofen by mouth, assuming that your general condition is safe for you to do that. Don't take Aleve or ibuprofen or any NSAID without taking a stomach acid blocker. Even if you haven't had a prior ulcer, let's not start with this. The back pain is bad enough, right? We don't need an ulcer as well. So take Prilosec, 1 tablet a day, or Pepcid. Pepcid's kind of cool because it comes with Tums with an antacid, what they call Pepcid Complete. And it is twice a day, but it's very effective. And then moist heat means a shower, a hot shower, jacuzzi or steam room. If you have access to those, both of them are wonderful in this situation. And rest. You don't want to be too, you do certainly nothing with impact, but you need to stay active. If you can get in a pool and walking in water, it's a really good time for this. Light walks, rest, but not, don't take the rest too far. So those are the things that we need to look at for right now, those three things. The next thing to consider is, let's get back on our timeline. So we're past the 3 weeks, and now we're in the 3 to 6 weeks. And in this time, it's really time to consider the type of pain that you have. And, there's three options here. And before you panic, like, oh, this is so complicated, it's no more complicated than chocolate, strawberry, or vanilla, right? We just need to decide what is the most likely cause of your pain. And the three choices are discogenic pain, that's a tear in a disc; radicular pain, that's an inflamed or compressed nerve root; or facet pain, that's pain coming from one of the facet joints of the low back. That's usually due to arthritis. So let's talk about each one real briefly. The discogenic pain, it feels like a knife in the back, and that's because it's a tear in the disc. Nerve root pain is mostly not in the back, it's mostly in the leg, and it's usually associated with numbness and or weakness. It's electrical. It's not an ache, it's electrical. And it shoots in the letter, in the in the question on YouTube, they said it's going into the buttocks and the glute. That's very common, but usually it goes beyond that and down into the leg. Pain actually goes into the area of the nerve root that is compressed. So if it's a nerve root that goes to the big toe, it's the big toe area that's numb and where the pain shoots and all of that. Similarly with the outer foot or the inner thigh. And then the last one is facet pain, and facet pain has a very characteristic feeling, which if these things ring true for you, then you're joint pain or facet pain. And it's definitely back pain. It's usually not in the middle. It's off to the side. it really feels like your hip hurts more than anything. It feels like it's in your hip. The pain shoots out into your butt. When it gets real bad, it burns in the outer thigh. So people often confuse that outer thigh burning with sciatica, but it's not. There's no sciatic nerve to the outer thigh. That outer thigh, it's something called the lateral femoral cutaneous nerve. There is a nerve condition, neuralgia paresthetica, very rare, usually older people with a belly, but probably not you in this situation. All right, so 3 to 6 weeks, you watch my video and check the link below. By the way, while you're there, subscribe to our channel. We want you to be part of our team. We want you to get more content like this. So hit subscribe and get notified as well if you want to keep up to date. But watch that video. I put the link in the discussion. That is going to help you, give you more description like that to decide, well, what have I got? Have I got radicular pain? Have I got joint pain, or have I got discogenic pain? And the reason you want to know is if you have radicular pain, you need an MRI at this point because you may be a good candidate for an epidural injection. Now, some people say, oh, I don't even want to try that. Great, don't try it then. It's not going to change your overall outcome, but it is a good way to help control the pain. It's like having the most common use of epidural injection is having a baby. So, you have the baby whether you get an epidural or not. Same thing with the back pain. It's going to run its course whether you have an epidural or not. But it does give you about 100 hours of relief. And I mean, who doesn't want 100 hours of relief? And it can even be repeated a couple times. It does involve steroid, which is yucky. And it does involve a shot, which is, there's all that. But it is something to consider. If you're not considering having an epidural for your radicular back pain in this 3 to 6 week time period, then you do not need the MRI. And in fact, a lot of studies have shown that MRI is associated with a worse outcome. So not something to do. All right, then we get into the 6 to 12 week time period, and we'll talk more about that. This is the time when most people are going to see their doctor and go on and get kind of more traditional medical care. So that's what's next. I do want to show you really briefly the video that I want you to watch. This is what it looks like, types of back pain, Dan Lieberman, MD. Look at this guy. It's kind of a much younger version of me. I think this was 15 years ago. Might have been almost 20 years ago now. Look at that guy. That was my favorite shirt at that time. I remember that striped beauty. Anyway, I go through the different kinds of pain and what to expect.
Practical matter, it comes down to one of three different things in almost everybody's case. The first possibility is that it's a joint in the spine that's caused.
I love it. Back then we were making videos. We put the light plug right in the frame. So, it is what it is. But very, very exciting and very interesting video. It'll tell you what to do. All right, we're ready to move on, and we're going to go now to the next section, and that is the 6 to 12 weeks. But before we do, I think you should know your odds. Look, what's going on here is really serious in terms of the magnitude of the pain. And a lot of people start to panic and they feel like, oh my God, I really cannot live this way. And I got to do something. I just got to do something. I don't care what he says about what's proven to work. I just need to do anything. No, your odds are really, really good here. In fact, number of studies and systematic reviews have been done where everybody who gets non-specific low back pain, which is what you have, are pooled, and we look at it as a group. And I can tell you this right now, 94% of you are going to get better on your own without any intervention of any kind within 12 weeks. So let me say that again because it's just crucial to understand. 94% are going to get better on their own within 12 weeks. Those are the odds, and those are really good odds. They're really good odds. If you had a 94% chance of winning at roulette, would you play? This is the lottery. Would you play the lottery if you had a 94% chance of winning? Heck yeah, you would. So there's a 94% chance you're going to get better, but I said something else, and this is the part people often don't hear. Within 12 weeks, not 12 hours, not 12 days, 12 weeks. So that's a long time to carry around this really severe pain. If you've done your red flag checklist and you've looked for urgency and you've watched the video so you know what kind you have and whether you were a candidate for epidural, then you don't need to obsess that you're missing out on treatments that could be helping you. You need to calm down, continue your big three: rest, nonsteroidals if they're safe for you, as well as moist heat, and keep on going because there's a 94% chance that you're going to get better on your own. All right, let's get back to our timeline and see where we're at. We're now, so we've finished the 3 to 6, we're on 6 to 12 weeks, and this is a good time to see a doctor. It could be a chiropractor. The reason is there are some conditions, and they're things like compression fracture, infection, and even the big C, cancer, which very, in my career, I saw like 20,000 patients, and one person was diagnosed with cancer from one of these early x-rays in that entire time. Now, a lot of people had cancer, they knew it, and it became a problem, but it's very unlikely if you haven't had it that is the issue. But again, we're doctors, we want it to be perfect, we obsess on not leaving anything left behind, and so that's what we do. But it could be compression fracture that would be treated with kyphoplasty, injecting cement into the broken bone. It could be an infection, antibiotics. So all those are important things to know, and they may require additional imaging. And again, just relax. If your x-ray is negative, that's what was expected. Get through your 6 weeks and move on. All right, well, now we're at 12 weeks, and presumably you have facet type or discogenic pain, and you didn't get better. It's unfortunate. You should have, 94% chance, but there's always, if you're in that bottom 6%, then it's time now after 12 weeks to get a x-ray and then an MRI, and you take those to a surgeon or a pain management doctor. You need to see a specialist in order to get evaluated and see if it's time to get something done. But again, that's only 6 out of 100 possible people. Out of 100 people, that's only 6. Well, I hope this helped. To the person who asked the question, what do? I don't know what to do. Now you do. Watch this video, click in the link below and watch the figure out which kind. Catch yourself up wherever you're at. Based on your letter, I think you're about 9 weeks into it. So do everything for the first 9 weeks and then watch the rest. And I wish you the best. If you're watching this video and you have questions, please feel free to address them. We do look at every question on the YouTube channel every day. And if it's a question that affects a lot of other people, I'll do my best to answer it in a format that works for you. It's really been nice talking with you today, and it was really a pleasure, and thank you for your attention. Have a great day, and I'll talk to you soon.